So I appreciate I can sound like a broken record, but I cannot emphasize enough that if we have a good and cogent plan to manage congestion and post-surgical swelling, the process is a lot easier. One is that we find that it's easier to achieve greater range of motion. Two, our athletes have subjectively a lot less pain and use a lot less pain medicines. Three, we have tissues set up in a healthy environment where the collagen can begin to knit down. That really effused joint is not a healthy system. Now the problem is, of course, we're always gonna be up against the fact that I can't move or load the tissue the way I need to. The system is all bootstrapped on top of the movement system. What system I'm talking about? I'm talking about your lymphatics. You're being able to drain and manage congestion. Gravity will work, manual compression will work, self-massage works, but ultimately this lymphatic system was all built on the fact that it was predicated on the idea that humans are going to move because we need to survive and sleep on the ground and toilet and do those things, and that system is built into that. So with modern surgery, we need to immobilize tissues. We need to protect them as they're appropriately loaded, which means that we just can't get the kinds of motion in that is required, especially after something like a total knee replacement or shoulder surgery, where we're trying to protect the tissues initially. We're trying to make sure that we don't rip out the work that the surgeon has performed in terms of the stitching or repair. So one of the things that we can do then is think, how do I get movement without motion? And a simulacrum to that, an analog to that, is using the Normatec boots, which are basic. I'll show you how it works, is sequential compression that pushes the lymphatics out. Now, that's sort of self-explanatory. So ideally, I like to use both legs at the same time because we can get big load in. And if you're doing one leg, you might as well do the other leg, especially since we're tending not to move as much. Remember, if you have cankles after a long airplane ride, that's the same thing that's happening when we just don't move. We're just gonna see congested tissues. A good baseline is if you push on your bone here, any part of your system, you push really hard, you shouldn't leave a divot. And if you're leaving a divot, here I push really hard and don't have a divot. If I'm leaving a divot, it says that my tissues may be more congested than they need to be. Again, that we call that pitting edema, and certainly normal people should not have pitting edema, but if you push on your leg and you leave a big bump there, that's a problem, especially in these small interstitial spaces. But around surgical issues, surgical repairs, we'll often see that people will have some kind of pitting edema, and that just means that, hey, I have tissues where the tissues aren't sliding and gliding. I'm not getting a lot of blood flow in here, and those things need to be worked. So getting it warm would be great beforehand, but I don't have to worry about it. What I'm gonna do is say, hey, let's control what I can control. So I've just cooked up a single leg here. I'm turning the unit on. I can adjust up and down in terms of how I've gone all the way up. And then I love to rock this thing for an hour. I want you to understand that that any input you can give to your body is net positive. If that's 5 minutes, count it. If it's 7 minutes, count it. If you can get an hour in, great. So there's never a time where you should think, hey, I don't have time for this, or I'm not going to get a full 30 minutes or an hour because I have family duties or a job. It doesn't matter. Our job is to get as many little micro doses as we can. Clearly, we're huge fans of walking and riding a bike and moving as much as possible. That's the first order of business. It's free, it's accessible, little loops around your couch all count. How do I get as much movement in as is appropriate? One of the things that we're always going to be battling, even if I've had a surgery down below, is as I stand up, I'm going to be once again sort of overwhelmed potentially by swelling, because the everything below the heart is sort of gravity dependent. It's the tissues are always going to be fighting an uphill battle. So oftentimes we've loaded a tissue during rehab or my exercises, and then I need to get off it and elevate and sort of manage. So let's think about, I won't have to play a perfect game, but instead what's gonna happen is I'm gonna move in and out of, man, my tissues are super congested, and now I'm recovered, and now I'm managing swelling, and then I'm loading. And I'm just gonna keep playing back and forth. So a couple great uses of Normatec. I like to stack these devices. I love to use my H-Wave to pump and get a big muscle contraction in the boots. I had access to those things. But if you want to use these or using these, I love to get an hour at a time if I could. And I would tend to ride these things. It was nice to be in the boots. I still need to go bend my leg or move around a little bit. But what's nice is that giving this enough time to do its work in these long cycles is really great. Typically in a non-injury, non-clinic sort of setting, you might, at the PT clinic, you might get 20 minutes. That's fantastic. That's 20 minutes of a bike ride or decongestion. So don't poo-poo that. That's really great. If your gym has a pair of new Normatec boots, if your PT clinic, it's actually good for you to say, hey, I don't want to invest in these, but I'm going to go there on the regular and just jump in there, read a book, answer emails, do something like that if you can. One of the best case uses of the Normatec is to use it prior to the rehab, prior to the exercise. What I like to do is say, hey, how can I get my tissues maximally ready for the loading that's going to happen, and then realize that I'm probably going to need to use it afterwards. In my own experience, I was able to ski at that sort of 12-week mark, right when we saw that those tissues, bones were grown in. I went and skied, but my legs swelled amazingly. It looked like hamburger after that, and I had to come back to baseline. So yes, I was able to ski at 12 weeks. That's incredible after total knee replacement, but the tissues were not ready for ongoing kind of consistent loading there. So keep that in mind, that I'm trying to pepper this. If I was working in a situation where I could put one leg up and get some movement at my desk, net positive input is the game. I think if you know, our normal athletes who are well-bodied or able-bodied love to put these next to their couch. They watch TV. It's a passive system. It feels great. And your legs or upper body or hips, whatever you're compressing, can look great afterwards. So this is how we're using Normatec. Big, long swaths. If you can get 20 minutes in, great. You can use it to prime and prep the system. Awesome. Using it for recovery. And if you don't have them, we'll show you some other ways to take care of your tissues.